Well, just as the United States Senate passed a $2 trillion bill to alleviate the economic burden of the coronavirus on individuals in America as well as companies, jobless claims for the last week reached 3.28 million, a new record with more than 150 million Americans under lockdown and businesses closed. The Senate voted to pass the largest stimulus package in the American history. This as the top infectious disease doctor in the country expressed a view that the novel coronavirus could very well be seasonal and that the country should be prepared for its return, much like the flu.
On this vote, the yeas are 96, the nays are 0. The 60 vote threshold having been achieved, the bill is passed.
An almost unheard of unanimous vote in the Senate to advance the legislation to the House of Representatives in the hopes of getting it to the President's desk for signature before the end of the week. It would send payments of $1,200 to Americans earning up to $75,000 a year, with a gradual decrease in amounts offered to people earning up to $99,000 annually. An additional $500 will be paid for each child. It expands jobless benefits even for freelancers or gig workers like Uber drivers. Extends a $350 billion loan facility to small businesses and a $500 billion lending program to distressed companies. In addition, it provides a Marshall Plan of over $100 billion for hospitals and frontline health workers who are fighting the pandemic, among other measures.
I'm proud to announce tonight not a single senator voted against this $2 trillion rescue bill to save American individuals, small businesses, large businesses, and to provide considerable funding for the healthcare workers and the scientists and the doctors and others who are trying to solve this pandemic. So I think if I were writing your headline, I'd say the Senate has pivoted from one of the most contentious, partisan periods in the nation's history to passing this rescue package 100-0, all in one quarter of this year.
This as hospitals in New York buckle under the crush of new patients, with Elmhurst Hospital Center in the borough of Queens losing 13 patients in one day. A refrigerated truck stationed outside to hold the bodies of the dead. These nurses at Mount Sinai West in Manhattan wear black plastic trash bags fashioned into makeshift protective garb as personal protective equipment remains in short supply.
Most impacted states were 30,000. Next closest state is New Jersey at 3, California 2. This is a really dramatic differential, and this is what I argue to anyone who will listen. We have 10 times the problem that the next state has, which is New Jersey. You compare us to California, which is larger in terms of population. We have 15 times the problem.
You want me to get you into this political mess?
As one of the leading doctors fighting this pandemic suggested, the novel coronavirus could return seasonally, much like the flu.
The reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle.
A stark warning to countries gearing up for the winter months.
Dr. Fauci also tempered expectations that the US economy would return to business as usual as early as Easter in the middle of April next month. Speaking on a local cable news channel, he said, quote, "You don't make the timeline, the virus makes the timeline, and you've got to go with the situation on the ground." Sherwin Bryce-Pease, SABC News, New York.
And let's go to Sherwin Bryce-Pease, who's joining us in New York. Good evening and welcome to the special broadcast, Sherwin, as we count down the hours to the lockdown here in SA, 21-day lockdown. But speaking about the stimulus package, a $2 trillion stimulus package, yet Governor Andrews saying that it is irresponsible and reckless. Why?
Because he spent a lot of his own state money that wasn't earmarked to deal with the COVID-19 outbreak on the COVID-19 outbreak. So there's a sense, certainly from Cuomo, that the $5 billion that the state will get will have to be used on the current response to the coronavirus outbreak and doesn't replenish the resources that have been used in the interim on this virus. In fact, Aldrin, I have a clip from Andrew Cuomo, the governor of New York State. Let's play that, and I'll speak to you afterwards.
The stimulus bill helped unemployment insurance, and that is a good thing. It helped small businesses, and that is a good thing. It did not help local governments or state governments, and it did not address the governmental loss. And the federal officials, the ones who are being honest, will admit that. New York State receives $5 billion from the stimulus, New York State government. And it's earmarked only for COVID virus expenses, which means it does absolutely nothing for us in terms of lost revenue to the state. The only thing it's doing is helping us on the COVID virus expenses, which is nice, but the bigger problem is on the lost revenues. The congressional action, in my opinion, simply failed to address the governmental need. I spoke to all the officials involved. I spoke to our House delegation. I spoke to our senators. And I believe what they did failed to meet the governmental need. I'm disappointed. I said I was disappointed. I find it irresponsible. I find it reckless.
Emotional words, Aldrin, from a governor that really is in the center, the epicenter, if you will, of this outbreak. You won't necessarily hear the same level of vociferous complaints from other governors, maybe Washington State or California, where you see other big pockets of the outbreak. But New York really reeling here in terms of having to dole out money that wasn't planned for this very virus. So very much a complaint from the governor there.
Mm-hmm. And why is it the case, Sherwin, that we're not seeing the similar breakout and even in a similar pattern with other states taking place? And I see that the governor also tweeting earlier on saying that around 385 deaths mourning the loss of life amongst New Yorkers. Why isn't this being an experience in other states as well?
Yeah, overnight we had 100 and counting new deaths in the state, Aldrin. And the reason is because New York is such a densely populated area, right? And as the scientists have explained to us, this virus had been circulating in the area unbeknown to people, not showing symptoms initially for weeks, if not months, before the first case was identified. And so you perhaps don't have that kind of traffic in places like Idaho or Utah. But we are seeing this spread, Aldrin. Don't get me wrong here. We're seeing an upshoot, an uptick in cases in Florida. We're seeing an uptick in cases in places like Louisiana and in Michigan. And to quote Governor Cuomo in a message earlier this week to his fellow governors around the country, we are you in a few weeks' time. And what's at issue here? New York is accounting for at least 25% of all the tests that are currently being conducted in the United States. What other states have to do is upscale their ability to test, because if you don't test, you don't know. This is an unseen virus. It could be circulating in various states. And because there's a sense that, well, it's not happening here, the point is you don't know until you've tested and verified so that the response can meet the evidence and the data that those tests provide.
And looking at the number of tests, if you said that they account for at least 25% of the number of tests that have taken place in the country, for me what's important as well is that since the lockdown, has there been any indication whatsoever that there has been a flattening of the new infections and the curve as well?
It's too early for a flattening. Remember, we are trying to change a trajectory, right? You're trying to turn the ship around in rough waters, if you will, to use that analogy. And so the drift will be very, very slow. What we did hear from Andrew Cuomo yesterday was that hospitalizations were beginning to decrease. So, for example, initially hospitalizations were increasing by a rate of double every 1 day. Then by yesterday, he was saying that hospitalizations had increased by double every 4.7 days. So there was a view that the social distancing was beginning to work. But then just as that data and that projection came out, New York hospitals were again buckling under the pressure of, an onslaught of victims lining up to get in. You saw those pictures outside the Elmer Hospital precinct in Queens. That's really struggling in terms of being able to deal with the numbers that are penetrating the emergency rooms. They are moving patients with other conditions to different facilities so that hospital can be reconditioned and repurposed essentially just for COVID-19. And the hospital capacity in New York State is still being upscaled. They're building temporary hospitals in all the 5 boroughs of New York City and in various counties around the epicenter, 1,000-bed hospitals in Manhattan, in Staten Island, in Queens, to supplement the 53,000 beds that are available currently in the healthcare system in the state. The governor is saying that they require at least 140,000 beds for this wave that he is predicting, a wave of new cases, Aldrin, that is expected to hit us anything between 10 days and 3 weeks. So the worst is still yet to come.
Is there a sense at all that the USA was slow to respond to the virus and trying to prevent the virus even spreading to other states?
Well, let's quote the president. He was in Davos, Switzerland, where, that happens annually in January, where he was downplaying the severity of this. He keeps touting the fact that he was one of the first presidents to close borders to China and basically saying that if they had not acted as swiftly as they did in February to close all incoming flights from China, the situation would be much worse. Look, it's a political football, and what you're hearing from leaders in Washington is that we don't really want to focus on the politics right now. We have a public health emergency that needs to be addressed. Whether there were missteps in the lead up to this will be determined afterwards in the post-mortem once the public health emergency has been addressed first. And I think that resonates around the world. This is not a political football yet, but remember we are a few months away from an election in November, and I can assure you of this, Aldrin, it will become one.
I wonder what then happens to Donald Trump leading up to the elections in November, considering how he's dealt with this particular, what you say is not a political football yet, but I'm sure some people would use it as a political football as they head to the elections.
Well, Donald Trump, before he became president, Aldrin, you'll remember, said famously that he could shoot somebody. He was so popular among his supporters, he could shoot someone on Fifth Avenue outside his apartment block there and still get away with it. That's the level of support that this president enjoys from his base in this country. You have not seen those numbers waver despite the high numbers or certainly the missteps that we are experiencing in New York, the lack of ventilators, the lack of protective, what they call PPEs, personal protective equipment for the frontline health workers. You're seeing an uptick in the number of health workers that are contracting COVID-19. And so, these are all some of the permutations that will come to the fore as we get closer to the election. But in terms of Donald Trump's support, he has a solid 44%, 43%. That he's not going to leave his side. That's not necessarily a majority, but it's going to, the post-mortem of this will certainly influence how people decide to vote come November.
Is there any sense at all, looking at how when Donald Trump, for instance, was campaigning to become president, and also when he started his presidency saying that Obamacare must be kicked out, is there sense from some pundits at all that that was the wrong move? Had you had Obamacare put in place, there would have been a rapid response, at least from the public health system?
Well, we are actually celebrating the 10-year anniversary of the Affordable Care Act. Nancy Pelosi, the Speaker of the House, was speaking on Capitol Hill just this week to mark this momentous occasion. Look, there's certainly an argument from the left that, this kind of outbreak, the fact that there's still millions of Americans that don't have health insurance, despite the passage of Obamacare a decade ago, really does speak to what happens when you have a public health emergency and the strain and stress that places taxes on the resources of people that are uninsured that end up going to the emergency room where the healthcare system is then forced to deal with people that are not able to pay anyway. What is currently happening through the courts here, there's a decision from a federal court in Texas that essentially invalidates the Affordable Care Act. So there is a court process where Republicans are seeking to actually dismantle the law completely. And so this also, the healthcare and the economy, Eldrin, are two very pivotal issues that are going to be resonating throughout this election come November. It's a very, very big question in terms of if you look at Bernie Sanders, Medicare for all, that's his big platform, right? Give everybody health insurance and let's increase taxes for everybody. So it's very much part of the narrative here, certainly politically.
And also the human rights watchdog saying that what COVID-19 is doing as well is making very clear the glaring, what can we call it? The glaring disparities, exactly, the disparities between the haves and the have-nots. And we see that now around 3.3 million people filing for unemployment.
Look, I mean, if you look at what the stimulus bill does, right, the stimulus bill is essentially a law that is putting money, yes, for small businesses, yes, for companies that are struggling, but also it's putting money in the hands of individual Americans. The 3.82 million people that have filed for jobless benefits is a new record. You know what the last record was? The number is 695,000 in 1982. So that just puts into perspective what this double gut punch of coronavirus has done to essentially the richest country in the world in terms of the impact on business, in terms of the impact on individuals and families. And this is not something that's going to be unique to the United States. It's happening in Europe. It's going to be happening in South Africa. And so this is what stimulus was about. It really was to put money in the hands of Americans because they really want to fuel the economy again that has been essentially put into a coma, right? It's been induced into a slumber here so that they can deal with this public health emergency. And who suffers, Eldrin, whenever there's a crisis or a disaster, whether it's an earthquake or a hurricane or a tornado or a unseen virus? It's the poorest of the poor and the most vulnerable. And this is why you've heard the UN Secretary General Antonio Guterres today speaking in that virtual summit with the G20 leaders to say if we have to take collective action here. Countries cannot operate in silos in dealing with this problem. It's a similar message we heard in 2008 when we were dealing with the economic crisis. You cannot take action individually, that we are all too connected. Yep. Virus jumped over borders, right? So a collective and systematic collective response is required here, certainly according to Antonio Guterres. Indeed, and as they called it, the invisible enemy. And of course, our president, that is President Cyril Ramaphosa, was part of the G20 teleconference. This is a special broadcast as we build up to the lockdown that the country will be experiencing right at midnight this evening. And as the SABC, we have this special broadcast, and the special broadcast will continue until 1 a.m. We continue with our broadcast just after this.